Guys, welcome back to my channel. So today I thought I'd film a little video, like sit down, get ready with me video while I discuss how I ended up in the hospital needing emergency surgery and how I was under the influence that I thought I had an organ removed and turns out I didn't. So yeah, I just thought, why not explain that story while I beat my face. So I pushed my hair back and I look like a wet dog. Do my eyebrows first because it's a big debate. Do people do their eyebrows first and then the rest of their face, or do like a lot of people do their face before their eyebrows? I personally like to do my eyebrows before anything else just because it sets everything. I don't know if that makes sense, but it does to me. So for this story, we gotta go back, I want to say like a few months. I don't know. I don't remember the exact time my right side was hurting. I just know it was always on and off. So a few months ago, I started to get like a very sharp pain on my right side, kind of like where your appendix is. So I already knew like what the signs were if you had like appendicitis, but to my knowledge, what I was going through, I didn't think I had that. I just thought, oh, I'm just having some kind of pain. Maybe I ate too much like spicy food. Maybe it's trapped gas. So, and it would go away. So I never really put much thought into it. I just didn't really care. I was like, pain, whatever. People die every day. I'll live. Like I said, it wasn't that big of a deal to me. You know what? Nobody judge me for how I do my eyebrows, please. You know what? Actually, judge me. I need some critiquing. Oh my god, I already fucked up. I'm sorry, guys. I don't know how some girls talk while doing their eyebrows. I'm not one of those girls. I said I was going through like occasional pain, but nothing like too dramatic where I was like, I need to go to the fucking hospital now. I was kind of just like, whatever. If I die, I die. I think I have life insurance. So again, I just really never put in thought into it. So then back in June, I started to get the pain again, but again, it wasn't nothing like severe. It wasn't crazy. It wasn't like, oh my god. But it was like something I was like, what's wrong with me? So back in June, I decided to go to New Jersey for the rest of the summer just to like help out my grandma. And I hadn't seen my grandma in a long time, and she's been wanting to see my son since the last time she's seen him. So I was like, you know what? Why not? I haven't seen my grandparents in a while and I miss them. I want to say like at the end of June, I ended up getting all my stuff and I took a one-way flight to New Jersey because I was like, you know what? I don't want to come back here. I feel like I look like a box. I moved to New Jersey and I settle in and life is going dandy. Life is okay again. Whatever. And I started to get the pain a little bit more frequently when I moved to New Jersey. And I didn't know, because my dumbass was like, I don't know if that's because like, I don't know, the airplane and the oxygen levels probably like hit something in my organs and it's making them freak out. So, you know, me being stupid, I was just like, I'll be fine. I want to say the pain, I started to notice that I would get like pain when I would pick up my son. I would always put him on my right side, and mind y'all, my son's a little heavy. He's on the heavier side. He weighs about 35 pounds and he's only 10 months. I just assumed the pain was from picking him up so often and just letting him like sit on that one side. So I just said, baby, I just gotta start like not picking him up all the damn time or just moving it to my left side. So that's what I started to do. I just started to move him to my left side. By the end of July, I want to say, so this was around like the 15th, 16th, that kind of time frame, like the middle of July, I guess. Mid-July? I would get the pain again more frequently. So my grandma, she would start giving me tea. She said maybe you just have some trapped gas, which I assumed too, because I mean that's normal. You get trapped gas and it doesn't have a way out of your body, so you have to kind of make a way for it. So I would sometimes push on it just to see if that'll help. And then my grandma, she gave me kind of a heating pad to use, and that would help a lot too. And I didn't even think to take like medicine or anything, because like I said, I thought I'm this bad bitch, I gave birth, I can handle this. So it just never occurred to me to like, hey bitch, you might die, you need to go to the hospital. She started to worry, my grandma, because she's like, this pain hasn't gone away, are you sure like you don't want to go to the hospital? And I was like, nah, I'm fine. You know what, I'm gonna be back in Houston, I'll just go to like one of the doctors there, when really I was lying to her, because I was like, I'm not going to no doctor. So they can steal my money? I don't think so. No, but for real, I was just like, no, I'll be fine. Like, I'll go to one back home. I got this, grandma, I got this. And so she was just a real worrier. She was just like, I just feel like something's wrong. I think you need to go to the doctor, yada, yada, yada. So I was just like, yeah, okay. So by the end of the month, like I want to say like, I don't know exactly when I came back to Houston, but I came back towards the end of the month. I know that for sure. And the pain went away. So again, I wasn't worried about it. I was just like, probably just growing pain, or I don't know. I was just coming up with so much bullshit for it. So again, I wasn't really stressing about it. I was just like, yeah, I'll live. There was one day, so actually, scratch that. The day before that big day, I got the pain again, but it was just like a slight, the same pain I've been having. It was sharp pain, just like a really sharp pain that wasn't gonna go away. It just felt like trapped gas. And so I started to get a little worried, because I was like, okay, this is happening a little too much, and I gotta pick my son up. Like, I gotta be able to pick him up, and I can't do that because I'm in pain. So I said maybe it'll just go away. The next morning I woke up, pain was gone. I was like, okay buddy, like, you're going through it. I don't know what's going on with you, but get it together. I was like, you know what, it's okay. I'm not dying, everything's fine. So again, I went about my day. Nothing strange happened. So me and my son, we like to take naps. Naps is a big thing in our household. When he naps, I nap, because even though yes, he's not a newborn, this boy has the energy of a damn toddler. So I just nap when he does, because I need as much energy as he does. I think it was a Saturday. It was a Saturday, because I had a quinceañera to go to. I had one to go to, and I was really excited to get ready and go. So that Saturday, me and my son took a nap. Nothing ordinary. I was just like, whatever. So when I woke up, I noticed I was in pain. Like, it was a lot more severe than it was previously. So I was like, okay. I noticed when I got up, so I got up from my nap and I noticed I was in some pain. I was like, oh, that kind of hurts, but whatever. I'll just get up and move around. Maybe my body just needs to get up. So I got up, and the pain just like, I don't know, it went from like a 6 to an 8. Like that, just super fast. It escalated so quickly. So I was like, ow, hurt, pain. So I called my mom and I was like, hey, I'm kind of in like a lot of pain. It hurts when I walk, and even my breathing feels kind of weird. when I breathe, the pain kind of intensifies. So she was like, okay, give it a few minutes. If you're still in pain, we will, go to the doctor. So I said, coolio. I said, I'm gonna just give it a few minutes. Hopefully, like, the pain, like, subsides. Nothing crazy will happen. Yada yada. That was not the case. That pain was very intense. It did not go away like I thought it would. It kind of just increased. So at this point, I decided to go lay back with my son because I was like, this pain isn't going away. I'm gonna just lay down and give it a few minutes. So that's what I did. I kind of just laid there and waited to see if the pain would kind of just go away. And it didn't. And it actually started to throb. I don't even know how to describe that, but it indeed started to throb. So then I called my mom crying because at that point it was hurting so bad. So she said, okay, I'll be there in a few minutes. Just give me a few minutes. I'll be there to pick you up. So my son still wasn't up yet. Thank goodness, because if he was, poor soul, I would not be able to pick him up and he would have been like freaking out. I was just in a lot of pain, and so I was waiting on my mom at that point. I was just like, I'm gonna just wait on her. She'll come and get me. It'll be fine. I'm waiting and waiting, and I text her because I was still like, it wasn't even that long after she hung up the phone. I think it was like 5 minutes. I was like, where are you? And she's like, I'm on my way. Just give me a few minutes. Don't panic. So I was like, okay. And eventually she got there, and this was the time my cousins were here from, Boston. So one of them helped me get off of the bed because, y'all, when I tell y'all, I was in so much pain. It was so bad. I feel like someone was just, like, had a knife in me and was just twisting it all around my organs. And, that's pretty graphic, but hey, that's what it was. And we were in her truck, my mom's truck, and we have a lot of bumps over here in Houston, so as we were driving, like, we went back to her house because she wanted to drop my son off because she didn't want to bring my son to the hospital. So she dropped him off, and every bump, like, was just kill me, shoot me. I didn't want to deal with it no more. I was just like, I'm done. I don't want to do this. Just, like, let me just lay on the street, please. I just want to die. So she's like, we're gonna make it. You're gonna be fine. So she hops in the front seat and we drive. We're on the way there. So I'm like gripping the hell out of the, like, I'm scared as hell grip thing. And I'm just grabbing it so tightly because it was just, Eventually we get to the hospital, and what happened? Oh, I thought, like, maybe I was gonna have to wait like a long time for a doctor to see me, but thank God, like, the hospital I went to was like one of the same hospitals I gave birth at, and they were super nice. They took down my name, and I didn't even have to sit down. They literally were like, okay, here's your little wristband, follow me. So I went towards the back and I sat down, and they were asking me all kinds of questions, and then they were like, this could be appendicitis. And I was like, yeah, I don't care, just make it stop. So they put an IV in and everything. And at this point, I still wasn't getting any medicine, so I was just still in pain. And I was telling them, like, it's like a 9. I don't care what y'all gotta do, but make it stop. I was waiting for, I guess, the nurse for my case, I guess you can say. And she was also asking questions, and she noticed I was in a lot of pain. And I was also, like, you guys know, hospitals are, like, freakishly cold, but it's like that for a reason. I'm waiting there. I'm in a lot of pain. They bring me some heating, like, blankets to help me. And I couldn't do anything by myself, guys. Like, I needed help to lift. I needed help to squat, just anything. And I was shaking because I was just so cold. And I just remember they're like, we're just going to take a few blood and we're going to take her to, like, the CT scan to see if, if it is appendicitis. So we're waiting. I think we were there for a good, I want to say 3 hours before anything really happened. And we finally, my mom ends up, I forgot where this woman went. I can't remember. She went somewhere. I can't remember. So I know they took me to CT and they wheeled me into the room. First of all, the lady who pushed in my saline, rough, because that shit did not feel good. I mean, I don't know if it's, I mean, I know it's not supposed to feel good. It's not like, oh yeah, drugs. But, you know, it hurted. It hurted a lot. So when she did it, and then she put in the contrast so that they can see like all up in my organs. And at that point, obviously they can't tell anything just quite yet. So they wheeled me back to my room, but it did make me feel a lot warmer. Whatever the contrast, because she said it was gonna make me feel warm. So like me being cold would eventually like stop. So I mean, I'm happy I did that, just because I was freezing cold. After that, they wheeled me back to my room, helped me back up. And one of the nurses, she was trying to switch back my IV and like blood just squirted all over the place. And I was just like, nice, you know what you're doing. And of course there's blood all over my white sheets, whatever. And then eventually one of the doctors finally came in. I want to say like 30 minutes after he came in, and he was like, so it looks like you do indeed have appendicitis. So I was kind of relieved at that point, because it's like, okay, great, they found the problem, now they're gonna fix it and I'm gonna stop being in pain. So my mom was like, oh man, I gotta call your dad. So we were just calling all like my family members and stuff like that, just to get them like to know like, hey, BT dubs, Amy's not dead, gonna. So my brothers are like, all right, we're gonna head up there, blah, blah, blah. Everyone, all my, like, my friend and whatnot, da, 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 da. And then legit, like, 5 minutes after my mom left, the nurse comes in and she's like, okay, we gotta prep you for surgery. And I was like, huh? And she's like, yeah, you might want to call your mom and tell her to come back and da, da, da. You're gonna go in the pre-op. So I said, okay, I'm gonna give her a call. So I call her and she's like, okay, I'm on my way. And so she comes like exactly when they're wheeling me, like they're about to wheel my whole bed to the pre-op room. And then we're back there, the nurses, they were just asking me questions like, are you a smoker, are you a drinker, and you have any piercings we need to know about, because I look like I got piercings all up in my body. So I was just like, no, I just got like my earrings and my nails and yada. So they were like, okay, perfect. So everyone came up, my family came, and so the nurses was just like talking to me. They were like letting me introduce everyone. I ended up meeting like the surgeon, obviously, and he was pretty cool. I met the anesthesiologist. He wasn't really like talking to me. He was just kind of like there, but he was focusing on other things, which was kind of irritating, because I was like, look, dude, my life is in the surgeon's hands, but it's also in your hands, because one slip up, I'm gonna be up in the middle of surgery, and I don't need it. So yada. Eventually, me and my whole family, we end up doing like a prayer, and then they had to go. So the anesthesiologist was telling me that this is the time that he was going to put in the sedative, I believe that's what it's called, and that I was gonna end up, you know, feeling drowsy. So I said, okay, cool. And I remember he was inserting it into like my IV, and the nurse was like, all right, you're gonna start getting really sleepy. And I was just looking at her like, yeah, okay. And I remember they were like wheeling me out. And then I just remembered nothing after that. Nothing. So when I finally woke up, I woke up in pre-op, and I was really drowsy, and the nurses were like, they weren't talking to me because they knew I was drowsy. They just kind of were like, okay, You're in pre-op. We're about to wheel you back to your recovery room or whatever that thing is called. I remember getting rolled into the room, but I don't remember, like, I remember, like I said, I remember going into the room and then just going in and out of sleep. And then I remember I asked my mom, or I asked both of my parents, I was like, can y'all stay with me? Like, I'm tired. I don't want to be in the hospital by myself because the hospitals are kind of scary. And also, I'm drugged up to the max, so I need someone to advocate for me. But no, my parents were like, no, we can't stay here. I got work. The other one was like, I gotta go watch your kid. And I was like, oh yeah, that. And so they were off to go do those things. So I kind of just, like I said, was going in and out of sleep. And I remember seeing my brother come in, and I was just so happy because I was like, are you gonna stay with me? And I wasn't really, I thought about it. I didn't say it out loud because I was just so drugged up that I was just, oh my God, my little brother, he came. And I never expected, like, my little brother to come and spend the night with me in a hospital. So I remember I woke up after being, like, super drugged up. I saw my dad, and I just remember being in a lot of pain, like, where obviously I had surgery. I ended up getting, like, 3 places where they cut me up. One's above my belly button, the other one's, like, to the side on my right, and then there is a tube in me, and that was for the drainage from what was inside of me. So my dad was explaining to me how my surgery actually took, like, 5 hours, and they were freaked out because they didn't understand why it was taking so long. But come to find out, I was born with gastroschisis, for those who don't know, and that means I was born with my insides out. So the surgeon who placed all my organs back when I was, like, a little itty baby, he didn't put all my organs back correctly, if that makes sense. So the doctor was having a hard time finding my appendix, and my appendix was somehow in the back and not, like, where it's supposed to be. So that's the reason it was taking so long and all that stuff. So, like I said, that happened and whatnot. And I just remember just being in so much pain. When I had to go use the bathroom, I loved the nurse that I had. She was so sweet. She really had the patience to, like, get me up and help me walk to the bathroom. And she kind of reminds me of, like, the nurse I had when I first gave birth. She really helped me and get back on the bed, because getting back on the bed was painful, and everything was just, that was my mood, So eventually, I just kept getting morphed up, or whatever drugs they were giving me. It was amazing. And I was just going in and out of sleep. That same day, later on in the afternoon, they wanted to get me up. I said, are you crazy? Do y'all see me? I just had surgery. I'm in pain. I'm not getting up. And they said, you have to get up. Your body can't get adjusted to you. You need to start recovering. So I remember I got up and I just had to sit back down because I was going to faint. It hurt so bad. And they said, okay, that's a start. We're just getting you up. And guys, I do not want to relive that ever. So anyways, I remember when I lay down, I would have, like, a panic attack because a lot of pain would just be, like, right here by my sternum, and I felt like I couldn't breathe. I would grab my brother's hand and I was like, get the doctor, I'm gonna die, like, someone needs to come help me. And what it was basically just trapped gas, because what they do in surgery to remove anything, they blow up your stomach to get, like, a lot of air. So the, you know, the end of that, you're gonna have a lot of air in your stomach. So that's what it was. It was just a lot of trapped gas. So as soon as I got up, I burped. I was like letting it out, and I felt so much better. That was kind of like the recovery process was a little like painful, but I got through it clearly. And I'm glad that I had like my brothers and them. I just hated having my brother there at the same time because God, he would make me laugh, and laughing involves your stomach. And I wanted to kill him every time he made me laugh. I remember he made me laugh so hard. We were walking around the floor, and I was laughing so hard trying not to laugh, and I ended up peeing all over the fucking floor, and I felt so embarrassed. But the nurse was like, it's okay, it's normal, like, it is what it is. A few weeks go by. I was supposed to go to the doctor a week after to go get a follow-up, just to make sure everything was good and dandy and nothing crazy. And can y'all even notice a difference? And so I went. Everything was fine to me. I felt okay. I felt kind of pretty back to normal. The only thing I did notice was like my eating habit was a little different, but I didn't really put much thought into that. But anyways, so I went to go see him, and I waited for like an hour in his office, not in his office, but you know. And when he finally saw me, he's like, I just want to make one thing super clear. And I said, okay. He's like, we did not remove your appendix. Actually, what had happened was that it wasn't your appendix that was causing the issue. It was actually your ovary and your fallopian tube. So y'all can understand my face, like, out of confusion. Like, what are you talking about, dude? You sat and told my parents that you removed my appendix. Like, how is my appendix still there? It just doesn't make sense. So he was explaining to me that basically what had happened was when they went in to remove my appendix, they noticed that my appendix wasn't actually inflamed. It was actually my fallopian tube and my ovary. So going back to how I had gastroschisis, basically the doctor who did my surgery, he put my ovaries high up. They were like kind of by my rib cage. So it was my ovary and my fallopian tube that was infected. So what he had to do was clean the infected area so that, you know, I could live. So that's exactly what he did. He helped cleaned it and removed any pus that was causing the infection. And that was that. I was very confused. And he's like, obviously you still have an ovary. I just cleaned up what was infecting it, obviously. And that's all he said. He was just like, that's what happened. So kind of find out it wasn't even my appendix that he removed. So the entire time I'm thinking my appendix is gone, but he told me, rest assured, you still have an appendix. So if you're still in pain, that could still be your appendix. So all in all, problem wasn't technically solved. That's that, guys. My ovaries are all fucked up, and I still have an appendix. So how does that work? I don't know. All right, guys. So this is my final look. Yeah. So thank you guys for sitting down and listening to me blabber for like an hour straight almost. I'm really slow when coming with my makeup. I'm really slow in applying my makeup just because I'm not the best at talking and putting makeup on. So yeah. Thank you guys for listening and being interested in my story. If you stayed to the end, I don't know, are you bored and that why you watch me? Hey, I don't care. You're still here. But anyway, guys, Thank you so much for watching, and I hope to see y'all guys in my next video. Don't forget to hit that like button and subscribe, and I'll be back with more videos as soon as I can. I'll see y'all when I see y'all. Peace. 'Cause you are the reason why